All right. So, in a previous video, I said I was going to make a special video regarding MRIs, x rays, imaging, things like that. Because this is a completely separate topic, and not everyone watching this may have had those things done. So, if you have received imaging, please watch this. If you haven't, feel free to watch this for your own information, but you can skip this one otherwise. So, here's the thing imaging is not as reliable as we once thought it was. Imaging is literally a picture in time, and that picture can change. That picture can even change in the moment or in the day, okay? So, for example, they have done MRIs on somebody with a herniated disc or a bulging disc, whatever you want to call it, and they've MRI'd them while lying down, which is the traditional method to do it. And then immediately after that, they took an MRI of them while standing. Guess what? That same person, within an hour of each other, their MRIs were completely different. The laying down one showed a bulging disc because guess what gravity does? It does kind of pull it down and can show that. But the standing one didn't show it. That shows us that literally within an hour of, taking an image, what we see changes. As we move, things move too. All right. Same thing with day and night. So they've done MRIs first thing, like laying down one first thing in the morning, and then like later on in the day. And again, because of gravity, because of changes that happen during the day, these images could be completely different. Again, same person, same day. Just the way you're standing, the way you're shifted, the way you're moving, the position you're in can also change your x-ray too, okay? This is really, really important because a lot of decisions are made off MRIs sometimes that are really not valid decisions. Now, since a lot of you are here for low back pain, I want to talk about that one a little bit more. There's been multiple studies now where they take people who have no low back pain, okay? These are healthy subjects that are volunteering to get an MRI of their backs. And they, say that they have no low back pain, no history of injuries, no nothing, okay? 40% of these people have herniated discs when they get the image back. These people don't have pain, and they follow up with these people. These people don't go on to have pain. They're no more likely to have pain than anybody else. Okay, this means there's an actual herniated disc that the people have no idea about. Now, you can see the opposite too. I have had many patients who have received imaging, and the imaging is beautiful. They're like, this spine is gorgeous, nothing is wrong, and they're in a ton of pain. So again, imaging and injury and pain are not always correlated. I want to tell you about a few other studies. So one is about back pain and arthritis. So back pain is most common between 40 to 60 years of age. All right. However, arthritis is something that does progressively increase as we age. So it's most common, obviously, in somebody who's 70, 80, 90 years of age. Okay. It just keeps going up. But back pain doesn't. Back pain actually goes down as you get older. All right. So if it was just arthritis that was responsible for pain, we'd see those climb together, right? But we don't. Now, another really cool study was done on the shoulder. All right. They took people who had a rotator cuff repair. So they had surgery done to fix a torn muscle in their shoulder. And these people had great outcomes. Okay. So on a clinical exam, they were great. Objectively and subjectively, they were great. They were really happy with their shoulder surgery. Okay. Now, it is not common to re-image something that's feeling good because it's expensive, it's unnecessary. But for the purpose of the study, they then took an MRI. And guess what they found? In 90% of these people, they had significant abnormalities of the MRI. 20% had complete tears, okay? They had complete tears in the muscle that were repaired. 16% had partial tears, all right? Again, these people were really, really happy with their surgery. They had just had surgery to fix these things, and guess what? These things were still present. For people who hadn't received surgery, so people, now going back to your healthy population, we have, if you take MRI of some people who are asymptomatic, they have no symptoms in their shoulder, they're like, yep, my shoulder's good. Let's see, 35% of them, or I'm sorry, 40%, sorry, I have a few numbers written here. 40% of them have tears. And again, they had no idea. Now the 35%, that came from the next one. So 35% of college basketball players, okay, so we're talking about elite athletes here, have significant abnormalities on their MRIs of their knees. Again, they're taking these MRIs on a healthy population on purpose just to see what it looks like. And they found 35% have significant abnormalities. But again, these guys had no pain and they're clearly not negatively impacted. These are elite athletes and they are doing fantastic. All right, so this starts to show, wait a minute, why are we diagnosing so much off an MRI or making huge assumptions about a person's functional capacity off an MRI or an X-ray when they're not actually that valid, okay? Now, let me be clear. There are absolutely cases where MRIs are helpful, okay? But chances are, if you're watching this video, your case isn't one of them. And you may have had a similar experience where you got told findings on an MRI. And from the last video that we learned that getting told some of these negative findings can actually negatively impact your prognosis, okay? It didn't help you. I want to tell a really fun little anecdote about a patient I had. It was when I was just starting out as a physical therapist. This guy was, I want to say he's about 78 years old, okay? And he was a gym rat. Like, he would spend 2.5 hours in the gym every single day. And this dude was like squatting, deadlifting. Like, he was active, okay? Probably one of the most active, elderly people I have ever seen and ever seen since. Now, he was having some weird, like, kidney stuff going on. I can't remember the exact reason, but for whatever reason, they did an x-ray of his back, okay? He didn't go in the doctor for low back pain. And I was seeing him for physical therapy, I think for like a hip flexor thing. I can't remember, this was probably about 8 years ago now. I just remember the story. I don't remember the exact details, but it was like a muscle thing. It was something pretty minor. And so, yes, he went into the doctor's office and he said he had never seen this doctor before. And you know how they'll like put the chart on the outside of the door? So this doctor kind of like picked up his chart, was looking at it as he walked in, looked up at my patient who, by the way, gym rat, 78 years old. Literally, this guy never sat down. So he was, again, probably doing what he did with me and was sitting there pacing the room because he was incapable of sitting, just because that's the type of person he was. And the doctor looked up and goes, "Wait, are you such and such?" And he's like, "Yeah." And he goes, "How are you walking? I saw this x-ray. I thought you would be in a wheelchair. You have like so much degeneration and this, I don't even understand how you're walking." This guy was like deadlifting like 150 pounds. No problem. And luckily for my patient, he wasn't really negatively impacted by what this doctor said. Some people, though, in that moment, it really could actually change the course of their life negatively because they might be like, and freak out. Okay? So this is a great example of this guy's image was apparently terrible. I never saw it. The doctor literally thought he was in a wheelchair, not walking, and he was doing great. And again, it was, unrelated to low back pain, why he even got the image done. Now, this can be some really big stuff to absorb if you've previously been told something like you could never do this because of what they found on an MRI. So when it comes to this type of stuff, I really do find a little bit more like one-on-one consultation in terms of like, let me see the image, let me understand your functional capacity, like let's see what's going on, can really be helpful here. It is really hard to kind of make this blanket statement because obviously, like I said, there are cases where what is on an image is important. But in my 9.5 years of doing physical therapy, I would say in under, oh my gosh, I'm probably making up a little bit of numbers here, but I would imagine it is under 5% of cases. Honestly, probably maybe 5% of cases that I have imaging for. Let's put it that way. 5% of cases that I have imaging for, does the image actually change the treatment plan and really make a difference? Okay, so again, there are people that it does, but it is pretty rare. And if you want to deep dive on this a little bit further, then please feel free to reach out because, again, pain is really individual. Everyone is really different, and I don't ever want to give anyone a false impression or like say anything incorrect in a blanket that I'm obviously in a video that I'm making that kind of does have a little bit more blanket statements in it for the general population. So I really hope that was helpful though, and helps to start getting you to like reconsider what you've been told and really re-examining it. Maybe it might not be as accurate as you once thought. So I really hope that helps. Thanks.